Hi, my name is Dr. Whitney Rybar, and I'm a physical therapist at Health in Motion, and today I'm talking to you about trigger point dry needling and the effects our patients are having. So dry needling uses a solid monofilament needle that's inserted directly into the trigger point of a muscle to help restore range of motion strength, reduce pain, improve blood flow, and help just relax that trigger point back to its normal state. So trigger point dry needling can be used to treat anything where a trigger point is the cause or source of pain. Acute and chronic conditions such as neck pain, low back pain, headaches, migraines, plantar fasciitis, tendonitis, and so many other diagnoses. Okay, so today I am needling a trigger point in this patient's right calf. So I'm palpating for that trigger point. And once I find a good spot, then I'm going to quickly insert that needle, and I'm going to move that needle up and down into that trigger point, looking for a local twitch response. Again, another nice twitch response is I'm going to keep moving that needle until those twitch responses subside. So after releasing the trigger point, then we go into functional exercises to restore range of motion and strength to that muscle group. So the benefit of dry needling over other manual techniques is that the dry needling is a little bit more specific as far as treating that trigger point, and we see results much more efficiently. So we see patients that have results almost right away after the needling as far as improvement in pain, range of motion, and strength. Health in Motion, empowering people to optimize function.